Good evening, good evening, my dear students who are responding. Good evening, Manir. Sherlyn, good evening. Yes, okay. And I want all of you to support me by asking me some questions. Okay, you could pin your suggestions over the comment box. Okay, and even you can share your concerns, queries, and questions related to OET speaking. So we'll be taking all those topics. You can send a suggestion. This topic is also it was sent by one of our students, a regular viewer of our virtual platform classes. This is our 36th session. Fine. Once again, welcome you all. So anyway, I have need any sort of questions which are okay or the students are not I feel like students are not having any sort of concern, so I haven't received any sort of questions for discussion. So I feel I hope we could directly move on to this topic. We're displaying the question, so have a watch on that. You can have a quick look and assist. Later I will discuss the question, I will explain you the question, and go for outline presentation. Okay, so let's have the question. Please, my dear viewer, there to support me for this virtual platform session. I thank him a lot. So now the question will be displayed. You can have a look on that. Here comes the question. Yes, the question is also it's already there. Yes. Okay. Yes, please read the question. Any sort of concern you have in relation to the question. So, inconsistent with the question means you can ask me. This is a home visit. And I feel like this is a different sort of home visit that we are dealing with. Yes, all of you just take a few seconds and read the question. Later, I will explain you the question by reading each and everything. Okay. Okay, so we'll move on to the question. Okay, I will explain you each and everything regarding the question and we will discuss. We will go for the role play presentation. Any sorts of doubts or queries means you can put your comments over there. I'll be very happy in dealing with all your concerns. Okay, I'll be able to, if I'm able to clarify your concerns, that will be more happy. It will be something which is more enthralling for me. I'll be more happy. Okay, it will be more energy for me. Okay, the setting is a home visit. I think so far no doubts for any of my students. Okay, all are much more in touch with the question. Okay, yes, home visit is the topic, but you should read. All are ready with the usual sort of introduction and all. I know that, but reading the question only you'll be able to understand the nature of the topic, how it has to be dealt with. Okay, yes. So you visit a 76-year-old patient who was discharged 2 weeks ago after having spent a month in hospital following a hemorrhagic stroke. Okay, home visit. 76-year-old patient discharged 2 weeks ago following a 1 month stay at the hospital. Okay, so the patient was an inpatient. Okay, so 2 weeks before the patient was an inpatient and he got discharged 2 weeks ago after finishing 1 month of stay at hospital. Okay, yes, complaint or the diagnosis we can say like hemorrhagic strokes. You should understand the situation. During your visit, the patient tells you that having problems opening bowels. Okay, so during our visit is progressing. So the patient is complaining of bowel opening problems. Okay, they have got some issues with their bowels, I think. So that is fine. Okay. And asked you for advice. Okay, so they are asking for advice. They need to come out of this bowel difficulties, bowel opening problems. They are asking you the remedies. You recommend dietary changes and laxatives. So what our purpose is like, we are recommending dietary changes and laxatives. That is what our sole purpose of this visit is. Confirm reason for your visit. Check up following stroke. Find out how the patient is feeling now. Mobility, strength, that, etc. Okay. So confirm reason for your visit. What is the reason for your visit? Okay, and find out how the patient is feeling now. We need to ask how the patient is feeling now, mobility strength. Okay, so all are ready with good morning. Is this Mr. Martin? So I am the community nurse on visit. In all those things. But here we cannot go for that usual introduction. Here we cannot go for that usual introduction because the patient is having hemorrhagic stroke. The patient is having hemorrhagic. So that sort of problems, mobility, speech, everything has got altered. Okay, so the patient had not stay at the hospital. Now has got discharged 2 weeks back. Okay, so we cannot take it as a door opening condition or a fresh home visit condition because the patient will be having some sort of serious discomforts following this stroke. So we can take the condition as if already we are dealing with the patient inside home. We are sitting with the patient nursing and is inquiring that thing. Okay, we need to take some dialogues that we are staying with the patient and is asking about his problems. Never take this one as a door opening introduction. We cannot go for like because hemorrhage is stop. We cannot expect the patient to come and open the door. So whenever there is some home visit, I want all my dear students to see what the condition of the patient is depending upon if the patient has got a femur fracture, will we be able to expect the patient to come and open the door? No, femur fracture means patient is bedridden. Okay, spinal injury, bedridden. Okay, so we cannot expect all those cases the patient come and open the door. No, so see the situation, see the diagnosis, and follow for proceed with that. So now here we are taking this home visit as if we are already as if we are attending the patient inside home. Take like that. Okay. So confirm reason for your visit. The reason you can explain. So you can take the name and all first itself. Non-case, home visit. Fine. Okay. And during your visit, the patients tell you that okay, and find out how the patient is feeling. So the present condition of the patient, we have to ask them, reassure the patient. Okay, so regarding mobility strength and all, you should have a watch with the patient. Next, reassure the patient because no need of embarrassment. Common problem. Constipation is a common problem. Find out details about patient's bowels. We need to inquire more about the patient's bowel habits. That means frequency of movement, consistency of stool. Okay, all those things we can ask. Regarding the bowel characteristics, we can ask the patient. Yes, explore any remedies tried. We need to ask whether they have tried any remedies. Okay, we need to ask them whether they have tried any remedies. Okay, next, explore any other symptoms. We need to ask the patient whether they have got any other symptoms like abdominal cramp, abdominal pain, cramping or weight loss, loss of appetite, fever, bleeding stool, rectal bleeding or pain. All these complaints we need to confirm with patient. Okay, next, possible causes of patient's constipation. So we can suggest them some possible cause of constipation in the present condition. It can be because of medication, change in routine, hospitalization, rest, reduce mobility because the patient is hemorrhagic stroke. Okay, having hemorrhagic stroke, the diagnosis. So we can suggest all those reasons, the mobility and all is disturbed. Okay, next one is like find out patient's diet. So we need to ask about the diet, amount of fiber, fluid intake, all those things we need to confirm with the patient. Next was advice on dietary changes. Finally, we can give an advice on dietary changes. We can ask them to increase high fiber foods, fluids, vegetables. Okay, reduce intake of low fiber foods. All those suggestions we can give to the patient. Next one is recommend laxatives. Laxatives in the sense over-the-counter natural prune juices and all we can suggest to the patient. Okay, advice need to see doctor if symptoms don't improve in 2 to 3 weeks. Finally, we can end up the conversation by requesting a doctor's consultation in case if the symptoms doesn't improve. Okay, so that is how we need to give a conclusion to the topic and we can say balance. Okay, by fixing a con by requesting for an appointment in case if the symptoms doesn't or if the symptoms persist. Okay, that's all regarding the topic. I think the question is clear. The question looks like a heavy, bulky, multitask question. There's nothing to worry about. You can manage it. Okay. There are certain questions that we need to crack in this particular role play. So it would be your doubt. Once after watching this class session, you'll be able to come out of all your concerns again, effectively deal with the topic. Yes. So as I mentioned, we can start this topic as if you are already sitting inside home with the page. Can never say like we never started with the door opening introduction because we cannot expect the patient to come and open the door situations like that. Okay, so we'll start now. Before that, can anyone, those who are watching me, can anyone just give me an idea regarding how to start the topic? So what should be the presenting dialogue, the initial introduction dialogue? Can anyone say like that? Anyone can just give me a rough sketch of introduction state sentence? Yes, I'm asking you, my dear students, those who are watching me. Oh, so now I'm going to start with the all of you. Please listen anyway. I know that you people are very shy and inferior. Don't behave like this. Okay. So if you people don't encourage me, then how would I be able to take class in a good energy? Okay. So I want your cooperation to support me with your likes, your shares. Okay. Yes. Now I'm going to start the topic. Just listen how we are formulating the introduction. Okay. We can address, we can ask the patient to tell their name. So we can mark. We will share the traditional name that I'm using. The name I'm more used with is Mark because my comfort. Okay, the thanks comfort. That one is the name. Okay, I'm more familiar with. Yes. Okay, so I'm going to call the patient Martin. And throughout the conversation, wherever I use a name, I'll be calling them with Mr. Martin because I think this is an elderly patient for 60 years. Okay, so wherever you address, salutation can be given. What I'm trying to say is like never carry on with name, never repeat the names. Name should be uttered in a role play for a fixed set numbers. Okay, never go with Mata Mata Mata. This is a name Mata, it's a problem. But we have pain Mata, never go like this. For a role play, there should be limited number of names that you should use. The frequency of names should be limited. Never uh, go for all those things. Can you display the question? Okay, Ashwati, good evening. Good evening, Mane, all of you. Thank you for supporting me with your comments. Okay, yes. Fine. So, I'm going to start the topic. We are calling the patient Martin. Okay, I'm going to call the patient as Martin. So, we are going to start the conversation. Good morning, Mr. Martin. Okay, good morning, Mr. Martin. So, I'm going to start the conversation. Good morning, or whatever it is. Good morning, Mr. Martin. My name is Abhilash. I'm the nurse on home visit. I'm the nurse on home visit. Okay, it's a pleasure meeting you at home. So that is the dialogue I'm going to copy and I'm going to replace this one as a visit. Good morning, Mr. Martin. My name is Abhilash, the nurse on home visit. Doctor has asked me to come to you. Doctor has asked me to come to you. It's a pleasure meeting you at home. It is a pleasure meeting you at home. So this is how I'm going to introduce the patient. So by that statement, it's clear that we are already there inside the home and we're sitting with the patient. Okay. Good morning. Good morning, Mr. Martin. I'm Abhilash. My name is Abhilash. Okay. The nurse on home visit. Okay. I'm the nurse from the hospital. Doctor has asked me to come to you. Doctor has asked me to speak to you, or doctor has asked me to come to you. How are you doing? Okay, I'm here to see how you are doing. Okay, I'm here to see how you are doing. It's a follow-up checkup. Okay, instead of follow-up checkup, we can just say like that. Okay, good morning, Mr. Martin. My name is Abhilash, the nurse on home visit. Doctor has asked me to come to you. I'm here to see how you're doing. Tell me, how is everything going on well? Hi, Bonnie. Hi, Goldie. Good evening, Mane. Okay, all of you, good evening. I'm very happy you all have joined with me in this session. Okay, yes. Okay. So I'm going to, yeah. Good morning, Mr. Martin. My name is Abhilash, the nurse on our visit. Doctor has asked me to come to you. Okay. How are you feeling since discharge? Is everything going on well? Okay. How are you feeling since discharge? Is everything going on well? Okay. Okay. So they'll be saying like, oh, nurse, pleasure meeting you. Okay. This being given like mobility and strength. What about your moments? Okay. What about your moments? Okay. Are you okay? How about your movements? Are you moving well? Okay, so that is how we can ask. Okay, so they will be responding to our initial warm greetings and our general inquiry. They'll be responding. Well, tell me, how is your movements? Okay, are you able to move well? How is your movements? Okay, are you able to move well? Okay, did you try moving? Okay, did you try moving? Okay, so they will be answering yes, nasty. Okay, and big picture is my movements. Okay, what about your activities? It is given like strength. Strength in the how is your strength in the sense patient wouldn't be able to understand this word is strength. Okay. Okay. So instead we can just say like um, we can ask like their activities. Strength in the sense how the patient is doing with their activities that we need. Okay, okay. How is your activities? Are you able to control and coordinate by self? Movements and strength in the sense, instead of strength, we are just asking, what's your activities? Okay, are you able to control and coordinate by self? Are you able to control and coordinate by self? So they would be answering to all those questions. I hope all my students are getting me. Okay, just give me some indications whether you are following. At least one thumbs up or some emojis you could send me. Okay, you can just comment in the suggestion box. Yes, fine. Okay. How was your movements? Are you able to move freely? Okay. Did you try moving? Okay, that we can ask. Um, uh, yes. Do you seek any assistance? I mean, moving and all. Do you seek any assistance? Okay. So that is regarding the movements you can ask. What about your activities? Instead of strength, we are acting. What about your activities? Okay. Are you able to control and coordinate by self? Are you able to control and coordinate by self? Are you able to control and coordinate by self? Are you able to control and coordinate by self? Okay, are you able to control and coordinate by self? That we are asking with the patient regarding the activities. Okay. So the patient would be saying, hey, Manas, everything is going on well, everything is going on well. So patient would be saying like everything is going on well, nurse, but I have certain problems with. But okay, so are you able to control and after the activities, the patient would be saying like, okay, nurse, I'm doing a bit better, but the thing which makes me more bothered is that I'm more bothered on my bowel activities. I'm feeling it very difficult to having problems in my, opening my bowels. That is what my problem is. Okay. So we need to reassuringly answer to that state. Yes, yes, I understand. I understand. I know it is very hard to cope with. Yes, yes, I understand. I know it is very hard to cope with. It's distressing. Yes, well, that will be one of the terms that we yes. Yes, I understand. I know it is hard to cope with. It is very difficult to put up with constipation. Okay, well, it is very difficult to have this discomforts. I know you are in terrible discomfort, or that's terrible. Whatever it is, you can use any of those statements. Yes, yes, I understand. I know that's terrible. I know it is very hard to cope with. See, you don't have to worry. No, nothing to be embarrassed. Okay, nothing to be embarrassed. Nothing to be embarrassed. This is a common problem. Okay, it is usual among people of your situation. It is usual among people of your situation. It is usual among people of your situation. Okay. Well, I need to ask you a few more questions on your bowel activities. Is that okay for you? Well, I need to ask you a few more questions on your bowel activities. Is that okay for you? Well, I need to ask you a few more questions. Okay, well, I need to ask you a few more questions on your bowel activities. Is that okay for you? Okay, so the patient will be saying, like, yes, nurse, you can ask me. Okay, please, you can ask me. So the patient will be asking, well, tell me, how often do you push up? Well, tell me more about your bowel activities. You can start by like, well, thank you. Tell me more about your bowel activities, about your usual bowel activities. Can you tell me? Okay, your usual bowel activities. Can you tell me? Please tell me. How often do you push out? How often do you push out? Okay. How often? That means the frequency of bowel pushes. How often do you push out? Okay. So patient would be answering to all those questions. When did you last open up your bowels? When did you last open up your bowels? That is the last time. When did you last open up your bowels? Okay. What does your pew look like? P double O. Pew means stool, feces. Okay. Come, bubble content. Okay. What does your pew look like? Okay. What does your pew look like? The stomach content. Stomach content look like. That is the bubble content look like. Oh, not stomach content. Bubble content look like. What does your pew, P double O, look like? Okay. Uh, okay. How's the consistency? Is it very hard or is it very hard? Or you can just finish it right. So what is the consistency of stool? Is it very hard or patient would be answering to okay, is it very hard or soft or something like no need of asking the word soft. Instantly your intonation can what is the consistency of stool? Is it very hard or by the time the patient will be responding to the question? Okay. So the patient would be okay. Have you tried any remedials or did you try any medicines to help with constipation? Have you tried any medications? Have you taken any medications to help with constipation? Have you taken any medications to help with constipation? That we are asking. Okay, whether they have tried any remedials that we are asking to the patient. Okay, yes. So the patient would be asking more about, will be explaining all those things. Okay, do you have any other symptoms? Okay. Do you have any other symptoms or associated manifestations? Do you have any other symptoms or associated manifestations? I mean, any abdominal pain, cramping? Okay. Any abdominal pain, cramping? Okay. Any abdominal pain? Do you have any other symptoms or associated manifestations like abdominal pain or cramping? Okay. Is there any blood in stool, rectal pain, or bleeding? Okay. Is there any blood in stool? Okay. Is there any blood in stool, rectal pain, or bleeding? Okay. So this is how we are going to assess the patient's thing. Okay. Is there any blood in stool, rectal pain, or bleeding? I've got some tongue twist. That's it. Okay. Is there any blood in stool, rectal pain, or bleeding? Rectal pain or bleeding? We are confirming it with the patient. Okay. Is there any blood in stool, rectal pain, or bleeding? So they would be answering to all those questions. Fine. Okay. What about your appetite? Okay. What about your appetite? Okay. How is your taste? Okay. Are you taking well? Okay. Are you feeding well? Okay. Are you? How is your food intake? How is your appetite? Okay. How is your appetite? Okay. And what about the taste sensation? How is your appetite? Do you take enough food? Okay. How is your appetite? Do you take enough food? Okay. What about your weight? Do you notice any change? What about your weight? Do you notice any change? Next, one by one, we are asking, what about your weight? Do you notice any change? Okay. I mean, any up or down in your weight? So, likewise, the patient would be answering to all those questions. Okay. That's it. Fine. So the patient will be answering to all those questions. Thank you. Thank you, Mr. Martin, for answering me. Thank you. Thank you, Mr. Martin, for answering me. Now it's a lot more clear. Okay. Thank you. Thank you, Mr. Martin. Now it is a lot more clear. Thank you. Thank you, Mr. Martin. Now it is a lot more clear. Thank you. Thank you, Mr. Martin. Now it's a lot more clear. It's because we have got enough and enough of information regarding the patient's present situation. Okay. So now we are going to deal with the other task. Okay, outline possible causes. Okay, now it's a lot more clear. You don't have to worry. Okay, now the situation is a lot more clear. You don't have to worry. The constipation, as I have mentioned, the constipation is usual among patients of your condition. Okay, people of your condition. Okay, there are many causes. There are many causes. Most importantly, it is lack of mobility. Most importantly, it is lack of mobility. You were in hospital, okay, prolonged hospitalization and bed rest. Okay, prolonged hospitalization and bed rest would have triggered the situation. Okay, moreover, medications. Nowadays, you're taking more medications. Okay, medications and changes in your routine. Okay, alteration in your routine. All these would have contributed presence condition. All these would have contributed. All these are some possible causes of your present condition, or all these would have all these would have triggered the present situation. Okay, so there are many causes for this. There are many causes. Most importantly, lack of mobilities. You were in hospital. You were there was hospitalization, prolonged hospitalization, and bed rest. Okay, this would have triggered the situation. Yes, the condition. Moreover, changes in your routine, medication, all are some possible causes of um, your bowel difficulty. Okay, difficulty in your, all these would have contributed to your difficulty bowel movement. Okay, yes. And tell me more, now, please tell me about your diet. Okay, do you include adequate fiber in your diet? Do you include adequate fiber in your diet? I'm asking about more fruits, vegetables. Okay, I'm asking about that. Do you include more fiber? Uh, okay. Do you include more fiber in your diet? Okay. What about your, do you include more fruits, vegetables, and that is what the fiber, how, that is how we are questioning the fiber. Do you include more fiber? I mean, fruits, vegetables, are you consuming it in more? Okay, are you consuming it in more? So they will be saying like, they'll be giving you. Okay, what about your fluid intake? Okay, what about your fluid intake? Do you hydrate well? Do you hydrate well? That means, do you take enough of water? We are asking that you take enough of water, that we are asking. So the patient would be saying like all those things. The patient would be giving answers like, oh, no, I'm taking water now, and that's not that too much. And even fruits and vegetables, I'm really not much interested in. Okay, well, so now thank you for giving me the details. Well, thank you for giving me the details. I would now strongly recommend you to go for dietary changes. Okay, now I would like you to, okay, now I would recommend you to take dietary changes. Now I would strongly request you to make, okay, recommend. Now I would strongly request you to make dietary changes. Dietary modification is very essential in your case. Dietary modification is very essential in your case. In your case. Okay, Ashika, good evening, man. Good evening. Okay, dietary modification or dietary changes is very important in your case. Okay, it is crucial in your case. Try to include more fruits and vegetables. Try to include more fruits and vegetables. So these are foodstuffs rich in high fiber. These are foodstuffs rich in high fiber. These are foodstuffs rich in high fiber. Okay, this will facilitate bowel motility. Okay, this will facilitate bowel motility. Okay, this will facilitate easy bowel motility. This will facilitate easy bowel motility. Okay, there won't be any problem in pushing out. There won't be any problem in pushing out. So include more fruits, vegetables, so that thereby you can increase your uh, fiber intake. Fiber is very much very imperative in facilitating bowel movements. Okay, and stay hydrated well. Do take enough of water. Even that will help in softening the
bowel contents. It will so that will help in softening the bowel content and helps in easy push out and helps in easy push out. Okay, stay hydrated well, take enough of water so that it will soften the stool and helps in easy push. Okay, and helps in easy push out. Fine. And I will get, okay, if you're not interested in fruits and all, you can take fruits as juices, smoothies, or puddings. You can take this fruits as juices, smoothies, and puddings. Never take fruits as such. Instead, you can make fruit juices. You can make fruit juices, smoothies, and puddings. You can take like that. Okay, include more fruits and vegetables. Once again, I'm strongly recommending you that. Okay, fine. And it is a must to avoid low fiber foods. Okay, and it is a must to minimize the intake of low fiber foods. Okay, it is a must to minimize low fiber foods. Never do that. That will accelerate, that will trigger your constipation. Okay, that will trigger your constipation. So never avoid low fiber foods. Instead, take more high fiber rich foods. You don't, I know that you're quite confused. I'll get you some dietary charts. I will get you some dietary charts that will recommend you high fiber diets. You can follow that. Okay, I'll get you some dietary charts. Okay, that recommend you high fiber diets. That recommend you high fiber diets. You can follow that. Okay, it will help you a lot. Try it and see what changes does it make. Try it and see what changes does it make. Okay, even laxatives I can recommend you. You can take something from pharmacy. Okay, over the counter in this, it's outside pharmacy. Even with prescriptions, you can try some laxatives, some natural products like prune juices. You can try some laxatives without prescription. You can take it out from the pharmacy, from the over the counter. You can try some natural laxatives. Okay, like prune juices. Okay, it will help in relieving constipation. Okay, this will do a lot in relieving. This will do a lot in relieving constipation. Okay, this is proven to be very effective. This is proven to be very effective. There is no need of any prescription. You can buy it from outside pharmacy over the counter. You can collect it. Okay, natural products like prune juices. Okay, yes, these are proven to be really very effective in your cases. Try that too. Try that too. Okay, so these are some ways by which you can manage your situation. These are some ways by which you can manage your situation. These are some ways by which you can manage your situation. These are some ways by which you can manage your situation. Do you have any other queries? Okay. Do you have any other queries? Okay. Try it. Okay. Try it. That will definitely do a great help. Try it. That will definitely do a great help. All right, Mr. Martin. All right, Mr. Martin. You'll be saying like sureness. And you please notice and please put it in your mind in case the symptoms persist and uh, do have a okay. Be okay, Grishma Ramdas. Okay, Mane. Ashika, Grishma, good evening, good evening. Okay, I'm very happy that you people all are joining the class. Okay, thank you all for your support. Okay, and do have a close watch. Okay, and do have a close watch in case if the symptoms persist. And do have a close watch, Mr. Martin, or and do have a close watch in case if the symptoms persist. In case if the symptoms persist, worsen. Okay, in case if the symptoms persist, worsen or doesn't improve in 2 to 3 weeks. Okay, in case if the, and do have a close watch in case if the symptoms persist, worsen or doesn't improve within 2 to 3 weeks or doesn't improve within 2 to 3 weeks, never delay, get back to the general practitioner immediately. Never delay, get back to a medical facility immediately. Get back to the hospital immediately or get back to the medical facility immediately. Get back to the medical facility immediately. Okay, you're getting me. Okay, are you getting me? So they will be saying, like, yes, that's surely I will do that. Okay, hope I have assuaged all your concerns. Okay, you're more informed. Okay, okay, hope I have assuaged all your concerns. Okay, hope I have assuaged all your concerns. Do you have any other queries or concerns for me? Do you have any other concerns or do you have any other queries for me? Are you confident now? Okay. Hope you're confident enough to manage the situation. Okay. Okay. Are you confident enough to manage the situation? Okay. Just follow these instructions as advice. Okay. You will definitely feel um, You will definitely see an improvement. Okay, just follow this instructions as outlined. Okay, you will definitely see an improvement. Okay, that will help you a lot. That will help you a lot. And if you have any queries or if you are in any need, please feel free to contact. Okay, and if you are in any need, please feel free to contact. We are here to help. We are here to help. Patient would be say like, sure, nurse, I will be doing that. Okay. Shall I make a move now? Shall I make a move now? It's time for me to say a bye. Shall I make a move now? It's time for me to make. It's time for me to say bye. Okay, shall I make a move now? Okay, it's time for me to say bye. So they will be saying like, thank you, nurse. Pleasure meeting. It was really a pleasure talking to you too. Okay, it was really a pleasure talking to you. And thank you so much for the warm welcome. Thank you so much for the warm welcome. Take care. Thank you so much for the warm welcome. Take care. Take care. Bye. So this is how we are concluding the home visit. The nurse is leaving home. Okay, from the patient side, the nurse is leaving home. That's all regarding the topic. Okay. Hope the okay, so this is how you can start and finish the topic. Role play, not a usual role play like door opening situation. It was just like we, because of hemorrhagic stroke condition, we are taking this condition as if we are already attending the patient inside home with the patient. Okay, so this is how we are ending the topic. A beautiful conversation. Just try this, listen to this. You can just note down, never by heart. Instead, you need to practice it. You need to see how this goes. Okay, you need to see how it goes. Okay, so you have to uh, take a version of yours that through your intonation, make it more natural. Never by heart, mug up, or it shouldn't be like something which is spoon fit. Okay, just go for the practice, make it fit to you. All of you. Okay, any doubts, Mahendra Gowda? Good evening. Okay, any doubts or queries or concerns means you can throw it on to the suggestion box, comment box, my dear students. Yes. Okay. If you're not having any doubts, it's time for me to say bye. Our 36 live session. AG Binoy, hello. Okay, that's time for me to say bye. Okay, our 36th live session has come to an end. So see you for the 37th live session on next Friday. Till then, take care, all of you. Bye.